from the comfort of your home. Also wanted to say, please keep an eye out for your friends and neighbors. There's certainly massive changes to our society happening right now. New year, new president. Have more to say about that later, but thank you all for joining today and staying united, organized, and alert. Welcome. Do we have any public comments, Alan?
So I didn't see any requests for public comment, but is there anyone that would like to offer a public comment this morning? Okay, hearing none.
All right, looks like we have Michael joining us, Michael DiGeronimo joining us today from the Arlington Adult Day program to provide us some updates. So we look forward to your updates, Michael. How are you today?
I'm good, thank you. Can I show my screen, Helen?
You should be able to.
Okay. It's going to just show. I made a one pager for this. Let's see if I can. No, it's not showing up.
While we're waiting, oh, okay, that's all right. Okay, go ahead.
We see your calendar, Michael. Yep.
Sorry about that. Well, I will just unshare. I don't know why it's not. All right. Is it gone now, my calendar?
Yeah, it's gone.
Okay. You can still see the calendar?
No, we got the regular screen back.
Okay, sorry about that. I'll just go ahead and I'll start, and Helen can send the one pager around later if y'all are interested in it. But I was just going to tell you all a little bit about our program. Like William said, I'm Michael DiGeronimo. I'm the program manager at the Arlington Adult Day program. We're the only adult day program in Arlington, and we're one of the first ones in the state. Our program is about 48 years old, and we started up at the Madison Center 46 years ago. So we're really proud to have that distinction. But the purpose of our program is to improve the quality of life of the people that come to the program and their families. So we consider every person that comes to our program a client, and the caregivers, because we provide them caregiver support throughout and beyond people's time at our program. If you're not familiar with the Adult Day program, some of the things that we provide are healthcare monitoring. We have a full-time nurse, and we have 4 medication aides. We have access to mental health supervision and support. We provide therapeutic activities throughout the day that all have goals and objectives and a purpose. And we have a total of 10 staff, and we have to provide a 1 staff to 6 client ratio. So where that kind of comes into play is we also help people with eating, going to the bathroom, transferring, walking, and any other personal care that they need. So as our participants age while they're in the program, we can no longer provide care for them once they go beyond the 1-to-6 ratio. So we're finding right now in our program that we have a lot of people that are requiring more than a 1-to-6 ratio. So when we get to that, or we have a lot of people in that category, we have to discharge them. So we're just finding that more and more of our population is getting, they're coming into the program lower functioning, and when they get to that point, we can't keep them as long. So we have something called the Adult Day Acuity, and what it does is it is based on people's mobility, toileting, eating, communication skills, activity participation, and social factors, like if they are exit seeking, if they're cooperative, what their behaviors are. And we build this acuity to kind of gauge who we have in the program. And the best person to come into the program is a level 1. It goes up to level 5. And we only have 21 people in our level 1 and level 2. Everyone else is above that level 2 category. So the staff are really having to provide more care for them. So we are hoping in the future that we could move to a different location, a different building perhaps, where we can break our program up into by level of function. That way, as people age, we can keep them in the program longer with more staff. Otherwise, we have to discharge them, like I said. And Insight Memory Care Center in Fairfax is where we discharge a lot of our folks, but a lot of our people, by the time we discharge them, they aren't even appropriate for Insight any longer. We have 12 languages that are spoken here by clients. And our breakdown right now is we have 64% white, 18% black, 8% Asian, 6% Hispanic, and 4% MENA, which is Middle Eastern, North African, who don't identify as any of the other races. So I add that to my stats. Another thing we are kind of having an issue with is STAR. The transportation service in the last couple months has really gone on a downward spiral since the county signed in the new contract. So we're having people come in 2 hours late, sometimes getting dropped off at the wrong doors. So I'm working with STAR. I track complaints, any issues we have, and send those along for them to resolve. And I'm also sending them up to the folks up at Courthouse Plaza, or Bosman, I guess, so they can also track the issues that we're having with STAR. Are there any questions?
Do we have any questions? If not, I have a quick one. So Michael, is STAR, is the contract with STAR different from the individual use of STAR? You know how people can use STAR just like they use Metro Access.
Mm-hmm.
Yeah.
So for
can
our
you go into
program,
that?
we don't have a contract with STAR. Our families use them individually. But what I've decided to do is help the families navigate the complaint system and to make sure the complaints are getting where they need to go. Because when we've had issues before, really the squeaky wheel gets the oil in that case. So I'm hoping that things get better, hopefully everywhere at STAR, but my focus right now is our folks.
Definitely. Great. Thank you for staying on top of that. And yeah, shows how important transportation is to all other aspects of for older adults. Charlie.
Yeah, thank you, Michael. You mentioned that people who exceed the 1 to 6 staffing level needs, some of them go to Fairfax County Adult Day.
It's Insight Memory Care Center that's in Fairfax. It's a private.
Oh, okay. Is that a nursing home level of care?
We're a nursing home level of care also. So a lot of their folks may be exit seeking all the time, which is also called wandering. Their building is laid out differently. And I'd love for y'all to come over anytime for a tour to meet the staff and see the people that we're providing services for. But we're over at the Walter Reed Community Center, and we've got this really big room where we do our main activities, and we have a couple side rooms where we can do smaller activities. But when you have someone in the program that's just, well, for lack of better words, disruptive. If you have someone that is exit seeking, or they call out, or we have a person right now who spits all the time, you can't have that like in a main social room because it's too disruptive to the group as a whole. So when or if we do move, we'll have small rooms, hopefully off to the side like we did at our old building, so that we can break the groups up by acuity or how much care the people need. So we could have a room where the ratio is so the 1-to-6 ratio licensing, that's our minimum. So we cannot exceed or go below 1-to-6, but you can do 1-to-4, 1-to-3. It's just based on your business model. So if we started taking people that were lower functioning, we would have them in a space where they could wander if they needed to wander. They could call out if they needed to call out. Because as people progress, of course, with dementia, some of their behaviors and actions you cannot redirect. You just have to work with them where they are, and it's hard to do in this setting.
Yeah. Do you have any sense of how many, when they're discharged, go right into a conventional nursing home?
Well, I will tell you that in the last year, maybe we've had 2 that have gone to a nursing home. We really, really try to keep people in the program as long as we can. We have some people, and this person doesn't have dementia, but he's been in the program 29 years. We have people that have been here like 15, 16 years that live over at Culpeper Garden. And this really becomes who the person is. It really improves people's quality of lives. And we know that, and we recognize that. So also with a lot of our folks who started earlier, they've been in the program as they've progressed across this acuity scale. So they're used to what we do here. They're used to the pattern. They're used to the routine. So we really do our best to keep them here as long as possible.
Right.
A lot of people stay here until they die. Some people, families might hire in-home care. But this
I'm
past
just-
year,
But my thinking is that I think one of the biggest talking points for your program is that you keep or delay people from going to nursing homes. And I'm wondering
Oh,
if
yeah.
you can substantiate that as a talking point.
that's a
Well,
good
great.
idea. And it's
Thank
much
you.
more affordable.
Yeah, I see we have a couple of hands up, so let me call on
Okay.
Kathy and then Carlos.
Yeah, kind of along the same conversation that we've been having. What are the funding sources? And because you are covering nursing home eligible individuals, are you getting any Medicaid funding, through waiver programs to
Mhm.
support those persons to keep them at home and save Medicaid dollars?
Yes, we are certified to provide Medicaid services. I think we have about 7 people in Medicaid right now.
Okay.
We also receive aside from the Medicaid, we do receive some funding from AAA for our meals. So that
Mm.
brings our costs down. And then everyone else is private pay.
Okay, yeah.
So our pay scale goes from $10 a day up to $99 a day. So we base it on the income of the person coming to the program. So if it was a person that lived with their grown children, it wouldn't be based on their children's income. It'd be based on theirs, so that it doesn't affect households as much.
Got it. Thank you.
All right, Carlos.
Hello, I don't have so much a question, just a comment that I had the good fortune of visiting your center several years ago and doing a storytelling session.
Oh, yes.
Yes. And I remember the comment that we received after we were done with the workshop that you have a lot of speakers that come in and do their thing, but the comment that was received was interesting. They said that every single person in that room was completely engaged and glued. And that says a lot about the power of storytelling, and not necessarily as a result of the experience, but we are now in the midst of trying to develop an online book club, intergenerational book club, older adults and young readers, because I think stories do make a difference. So thanks for being here.
Well, thank you.
Thank you, Carlos.
Oh, and we have a
Tasha, yeah.
question. We have a question in the chat first. Kate
Okay,
was
what do we have?
asking Is there a waiting list to enter the program?
We do have a short interest list right now. So I do, and if you all want to ever talk about this program, it's really, really important to get people into the program early in their disease process, so that they, especially if they have dementia, so that they develop a routine, they develop relationships with staff, with other clients that come to the program. Because if you wait too long and the person, every day is a brand new day because their memory has declined so much, it's really hard to get someone here and to be successful. So the earlier we get people in, the longer we can keep them in. And routine and pattern has been proven not to stop dementia, but it slows the process down, and it just increases the quality of life of people that are in adult day programs.
Do we have any other questions? I know.
I
Yes,
see
Joan,
Tasha-
go ahead.
Tasha's got her hand up.
Oh, yeah, Kasia, I'm sorry, go
Yeah.
ahead.
That's okay. Good morning, everybody. Just a quick question. Can you share the information on how do you go about applying for the day program?
Sure. You can call our main number, which is 703-228-5340. And whoever answers the phone can gather your basic information. They can either put you on the list if you're interested, or they would connect you with our social worker, our nurse, or myself. The hardest part about our admission process is you have to get a physical signed by the doctor. And sometimes that's the most difficult part, just getting your appointment set up. And part of that is physical. You also get a TB test. And I also encourage everyone to get a Metro Access application signed, whether they think they're going to use it or not. We also, because we find that a lot of families don't think they're going to use Metro Access or Star, and they end up using it. So it saves time. But we have the person and their family member come in to do an admission assessment. They meet with our nurse, our rec therapist, and our social worker. We get to know a little bit more about the person. They learn about our program. And we can usually start somebody within a week of the admission process. And I think we have under 5 people on our waiting list, but it's moving very rapidly.
Thank you,
One more
Michael.
question, real quick. For individuals that do not have income, they're elderly and would meet the qualifications for this, is there a no pay
Well,
option?
if somebody meets the income level for Medicaid waiver, it's required that they apply for that. If they don't qualify for the waiver, we work with the family to make sure that they can come to the program, especially if the person's at risk in the community.
Okay, looks like Joan has her hand up.
I'm wondering how many people are in your program currently. And then I would like to just have a sample schedule for someone's day. How many hours are they there?
Okay. We have right now on our roster 33 people. But so far this year, we've provided services to 50. So that's people coming and going. Our day, people have to stay a minimum of 6 hours a day. Medicaid requires you be here a minimum of 6 hours. Some people stay 10 hours, depends on when they get dropped off in the morning. But our schedule is the same every day. We have a breakfast, social hour while we wait for people to come. We break into exercise groups, and then we break up into activity groups where there's 2 or 3 activities that people can choose from. And those groups last about half an hour. So there's 2 sets of those. And then we eat lunch every day at the same time. From 12 to 1, we have what we call downtime, where people can work on their own projects or socialize, or we have some people that nap and some people that watch TV. And then every day in the afternoon, we break up into activity groups again at 2 o'clock. And then we have a snack at 3 and people start going home. So we follow the same routine, but what we do in each of those slots varies quite a bit. So our activities all have to focus on fine motor skills, gross motor skills, socialization. We have cognitive stimulation, outdoors, and then we also do spiritual. So those are the things that all of our groups have to meet at least one of the goals that I just mentioned in those categories.
And do some people come maybe 3 days, or do all of them come 5, or?
You have to come a minimum of 2.
Okay.
And a lot of people come 5 days a week. So if their confusion is progressed, we may suggest the family that they come 5 days a week so that they get into the pattern and the routine. If they only come 2 days a week, there's all that time in between their days, and some people don't retain the information. So we have had to have people that are more confused come more days a week so that they settle in.
Okay, thank you.
All right, do we have any other questions? If not, Michael, really appreciate it. Well, Kathy has a question. Go ahead, Kathy.
Okay, sorry. A quick question. Are you accredited by, I think, NADSA, the National Adult Day Services Association? And if so, are there certain things that you have to abide by, like the whole, schedule of activities that you talked about?
So we're licensed through Department of Social Services in Virginia.
Okay.
And the national organization that we're part of is Leading Age. They are our advocacy group.
Right.
So we're only allowed to have one membership.
Oh,
So this is where you guys could also maybe help me out. But
okay.
we used to be part of NADSA and Leading Age, but in the last couple of years, we're only allowed to join one membership. And while I do work with NADSA still, Leading Age in Virginia does all the advocacy down in Richmond for us. So it didn't make sense to not join.
Okay.
Yeah.
And when you say allow, you mean the county does not allow you to join? Okay.
Just one, yeah.
Yeah. Okay. Interesting.
All right, great, thank you.
Okay.
But
Hey,
if you
Carlos,
all
do you have
ever
your
want
hand
to
up?
have a commission meeting here at
Oh.
in our building, I'd love to have you over and give you a tour.
Yeah, we'll take that under consideration. Carlos, you have your hands up. Did you have a question? No? Okay.
Okay,
Well-
William, there was one other question in the chat about the impact of the federal grants being discontinued. Would that impact Adult Day at all? And Jim Baker responded that there's been no indication that the Adult Day program will be impacted by federal grants being discontinued.
Because we don't receive any federal funding.
All right, thank you, Michael. Really appreciate what you're doing and for updating us. Much appreciated. And
Thank
please come
you.
back.
Have a
All
good day.
right,
William,
I,
before we move to the next item, can I just remind commissioners that in order for you to get credit for being here today, you need to be on camera.
that's right, thank you.
Yep.
All right, thank you, Helen. So before I forget, which I've already done, I wanted to introduce Karen. She's joined us, so just like with the rest of our commissioners, we really appreciate your spending your time, which is valuable, and joining us and contributing to your community. Thank you, Karen. Do you want to say a few words to introduction?
Sure thing, William. Thank you so much. I'm really so excited to be here. I have already, in the process of talking to members of the commission, learned so much about the resources that are available here in Arlington and the great need that exists here in Arlington. So I'm really grateful to be starting this journey. I want to shout out to Michael Bouchard, who introduced me to service on the commission, so really appreciate that. And to, of course, William and Kathy, who I met with initially, and I've spoken with several members of the commission, Carlos, Roland, and Kasia, among those. And if I've forgotten anybody, forgive me. But really very much appreciate the opportunity, and I had my orientation with Helen and Rachel last week. So I really appreciated the wealth of information they shared about how the commission works and its interrelationship with the county and the community. So I'm glad to be here and look forward to getting to work.
Thank you, Karen. Yep. And I'm sure in your intro, you took a look at the calendar that's available with all the different committees that are meeting. So feel free to jump in and see which ones strike you as something you want to jump in on. So thank you so much. There's so many things that you can contribute to. All right. And let's see. Okay, I saw a comment, but Philip, I see your comment. We will follow up with you. So next is approval of the January 2025 meeting minutes. Does anyone have any questions or comments on the meeting minutes? If not, do we have a motion to approve? Roland, and second by Audrey. All those in favor? Anyone against? Okay, motion passes. Thank you. Thank you so much. Next, staff reports. Helen, the AAA.
All right, thank you, William. Good morning, everyone. It's good to see so many of you. It's also good to see the sun out, and I hear it's going to actually be above freezing significantly today, maybe as much as 50s. So I hope you get outside and enjoy some of the spring-like temperatures, because who knows how long they'll last. So I too would like to add my welcome to Karen. We're so glad that you're part of the commission, and really look forward to working with you over the next 3 years. So a couple updates from me. So first of all, last month we reported that we were just days away from the DARS audit, and then weather happened. And so they decided to postpone because of snow coming in. And so it is now scheduled for March 4th through the 6th. So next week they will be on site, and hopefully, fingers crossed, the weather will cooperate this time and we can get through this audit so we get this off of our plate. And then also coming up shortly is the Community Engagement Forum. Planning continues for that. We will be at Macedonia Baptist Church, and there is, thanks to Carlos, there will also be a satellite location at the Clarendon Presbyterian Church, as well as satellite sites at Culpeper Garden, and we're hopeful to Carlin. I don't think that's 100% finalized yet, but we're working towards getting the site at the Carlin as well for the residents of those two buildings. So our theme is Safe at Home, and we now have 4 confirmed speakers for the panel. Joanna Shin, Captain Robert Bowen from the fire department, Sydney Palinkas from RAFT will speak, and Michelle Sosa from Child and Family Services. They're all part of our panel, and really looking forward to the event. So with that, we do need everyone's support in order to make this a successful event. So I did send a short survey with, excuse me, with the read ahead packet, and I'll send it again in the follow-up materials to get an indication on how you all want to help support the Community Engagement Forum this year. So if you haven't yet responded, if you would just please take a minute to respond to that survey so we know how you're going to help out. And then for the planning committee, big thanks to all of you for your help in making this, pulling this together. We will meet on Thursday, February 27th with the goal to review the questions that will be part of the breakout rooms. So that's Thursday, February 27th at 11:15. Audrey, I see your hand up. Did you have something?
I wanted to know about the flyer and when we can start sending out the link for registration.
So the flyer is out. It was included with the read ahead packet. You can go ahead and send it to your networks. The link for registration is included on the flyer. But if you need, something else besides the flyer, just let me know. Okay.
Thank you. Have registration started to flow in?
When I looked on Friday, there was one, but I know that, there's going to be more now. So I haven't looked yet this morning. Okay. All right.
Helen,
yeah.
Helen, this is Claire. I have one quick question. I finally got on. When you mentioned the Clarendon Presbyterian Church, is that the one near us in Line Village there on the
Yes.
corner? Is
Yep.
that it? Okay. Then I can probably walk over there. All right,
Yeah.
thanks. Sorry for the interruption. Thank you.
Great, thanks. Thanks, Claire. Okay, on to our other favorite topic, which is the budget. So still lots of unknowns with the federal fiscal year 2026 budget for the Agency on Aging. As you remember from previous presentations that Jim Baker has provided, roughly 47% of the AAA budget is funded by the federal government. And so we are watching very closely, monitoring the situation, and as we have information, we'll be able to share it. I would like to say that the county manager released his budget for the county fiscal year 2026 on Saturday afternoon. And we were really happy to see that there was $105,000 included for Meals on Wheels. Now, this isn't official until the budget is adopted in April. So if you get the opportunity to mention how important that is to make sure that it stays in the budget, we definitely would be grateful. And then just a reminder, the DHS budget workshop is scheduled for March 11th. And William will be representing the Commission on Aging at that workshop. We have also been invited to attend the Parks and Recreation workshop. It's the first this year that we've been included in that one. So that workshop is February 27th, this Thursday. And then after all of these workshops are concluded, then it ends with the public hearing on March 25th, and then the adoption of the budget in early April. So definitely keep you posted on how that's going. And then also on the budget front, the latest that I've heard out of the state with the budget conferees, and Erica and Terry, you can help me with this. But what I saw out of the budget conferences that occurred last week is that there is $750,000 in ongoing funds slotted for the agencies on aging across Virginia. It's not the 4.3 million that we asked for, but it is something. And so we are very grateful for that. And so as that continues through the process, and if the governor signs the budget, then I can let you know what that looks like as an allocation for Arlington. All right. Let's see what else. We talked about the Virginia Governor's Conference on Aging. Information is out now about what's on the agenda, as well as the registration information and the hotel information. So the most up-to-date information on that is on the Virginia Governor's Conference website, and I'll include that with the follow-up material that I send. And then finally, just a friendly reminder that if you are going to speak publicly on behalf of the commission has to vote that that is indeed the commission's position, okay? There is a process for that, and it usually is that you would submit a letter or some form of written statement that the commission can consider at one of our monthly meetings, and then take a vote on it. If there's not time between when you learn of an issue and the next commission meeting, then we can do an electronic email vote. But again, it requires that written statement. And then also a reminder that our DHS leadership has requested awareness of anything that you are going to bring to the board. And that's just so that we have the ability to respond when we're asked about it, okay? It's not by any means meant to influence the position of the commission or anything like that. It's just simply an awareness for our leadership. And also we'll do a little fact checking too, just to make sure it's accurate, so. All right, any questions on any of that? Audrey?
That's for county boards and all of the commissions?
So each commission operates a little bit differently, right? So, but like I mentioned in the email that I sent back to I think to you and to Cindy, it is in the commission handbook that that there is awareness with your county staff on what's being brought forward. And I can't remember the exact term. I'd have to go back and look it up, but So every commission operates differently though, Audrey, and this is how we've asked to operate.
Yep.
Okay.
Yeah. No, I'm,
Any other questions? All right, thank you so much, Helen. Is Maimuna or Rachel or either
So
attending?
Rachel's not with us this morning, but I think Maimuna is.
Hey, Maimuna, how you doing?
Good morning, everyone. It's good to see you. And thank you, Helen, for a comprehensive report. I don't have much to add. Thank you, Michael, for a wonderful presentation of the Adult Day program. We are continuing with all of our services, outreach, and programs, even during this landscape. There's nothing that has changed on our part. We continue to be more intentional about our outreach efforts because we have seen or we have heard from clients that are more fearful to come in and access services. So we are, again, still looking at ways that we can make sure people can access our programs. The DHS work session for FY26 budget will be presented by Anita and Deborah and Glenda Pittman on March 11th. And so you're welcome to attend. And Jim, are you on the line? I think we could send the link to you and we could drop that in the chat. That will be March 11th from 1 to 4:30 p.m. Are there any questions for me? Helen has really covered everything. I don't I don't have any things to really update. Any questions for me?
Audrey, you have your hand up. Did you have a question, Audrey? No, okay. Carlos, you have a question for Maimuna?
I'm just curious about when you made a comment earlier about some folks maybe feeling challenged to access services. Can you provide a story or some example?
I don't have any concrete examples right now. This is just beginning, and I imagine it will continue. I do know from our developmental services side, this is in our senior adult mental health, so more of our CSB side of the house is experiencing this. But I don't have any concrete examples.
If I could offer some examples that are concrete that happen in Arlington County. So there's
Sure.
a WhatsApp group that's been established to sort of allow people to be warned about where ICE is showing up. I had someone tell me that they were afraid to leave their apartment because ICE was outside their apartment waiting for people to come out. They didn't have food. They needed to go to the grocery store and they couldn't get out. I know someone who was driving and just stopped in the highway. Fortunately, his attorney had coached him on what to say, how to respond. But if there's any way, maybe we can do something, organize some kind of webinar just to sort of provide tips on how to appropriately respond. But it's happening.
Thank you, Carlo.
Yeah.
Thank you, Carlo. It's good for me to mention, with that said, that our department is going to start some trainings around Know Your Rights and to equip staff with that information. We've already had a number of departmental-wide presentations from Anita. And also we have across our department identified teams that will, from each division, including Aging and Disability Services Division, that will be the points of contacts should ICE arrive or any other law official arrive on our DHS campus in order to, handle those matters. So that staff are also going to receive the training, but we've already identified the teams And I happen to be on the team, by the way, as one of the points of contacts for aging. So that's how we're handling that.
I've
you,
also
Manuel.
learned that there's a new verb, doged. People have been doged. So, and I mean, I've talked to so many people that have been fired, laid off, and it's their livelihood. So when we think
Yeah.
about older adults and how that might impact older adults, suddenly the older adults are becoming the caregivers for their children.
Yeah,
So-
and I want to mention along those lines, Arlington Public Schools has been providing a lot of information for not just the students, but to parents in various seminars. So thanks Maimuna for what DHS is doing and what the county's doing overall.
Thank you. And Jim did add the DHS work session link in the chat. Thank you, Jim. And
Yeah.
Jim, do you have anything that you want to mention before I turn it back over to William?
I just wanted to say I'm also adding the FY26 budget page direct link so that folks don't have to dig. This is the most up-to-date information. I'm told that the actual proposed budget will be posted by Wednesday. So if you so choose, feel free to peruse the full FY26 proposed budget by the manager and get more details. So I'm going to put that link in the chat here shortly. And then also, Helen, you can send it out with your follow-up email.
Great, thank you, Jen.
William, just one more before we move along. Jennifer, I don't know if you had anything you wanted to mention from the Parks and Rec budget. Did you want to mention anything?
Hi, good morning. And I just dropped something in the chat on the lines of what Carlos was talking about, because just to go back to that real fast, we were hearing some of our seniors had concerns, especially at Arlington Mill. So we've been able to work with the police department and the sheriff's office and had some officers come out last week and speak with the seniors and answer any questions. They talked about the red card and just how they could respond to things, and also talked about scammers, because there's a lot of scams going around where people will say, oh, somebody's gonna call and be like, there's a warrant out for you, give us money. Don't do that. So there's a lot of information on that too. So just helping spread correct information, and we'll be working on one of those for Walter Reed also. As far as the budget, and this I'll say on behalf of the Senior Adult Council, and I'm meeting with the SAC chair later today, is that the one thing I know the council was pushing for is hoping to have Aurora Hill expanded for 5-day programming instead of 3 days. That was not in the county manager's proposed budget, but it was a mentioned in one of the things. And sorry, I started listening to it this weekend and realized that I didn't get all the way through, but I read what he had posted, and it's like one of the things like to have, but not in the budget, I think. So that I know is the one thing that's really the Senior Adult Council was going to be, I know, was hoping that they would see in the budget this year, the funding for that.
All right, do we have any questions for Jennifer? Okay, thank you so much, Jennifer. Really
Thank you.
appreciate it. And I'll certainly, yeah, I'll just leave it at that. So thank you so much. Helen, anything else?
That's it. Thanks, William.
Okay, thank you, Helen. All right, so yes, so thank you all again. And you, I think Carlos and a lot of people brought up the same issue, you know, all the rapid changes that are happening in our society. So we just really need to be on the lookout for our friends and neighbors so that we can make sure that they're okay and help them. For example, you know, as we noted, when people lose their jobs, they're at risk of losing their housing. Transportation, federal employees are going back to work, and you know, the roads and the rails are going to be very busy. Interest rates are still high, and not aware of any new housing programs or long-term care, so we still need to keep an eye on that. Equity is under attack, and you know, be vigilant. Healthcare, Medicaid is targeted for cuts. to pay for other things like tax cuts, et cetera. So we need to keep an eye on that as well. Please, really appreciate your working, staying organized. That's a good thing about our commission. We're organized, we're energetic, staying alert and working together, united. So those are all good things, but also as individuals work with, reach out to your county board, to your legislators, to keep these issues top of mind. So I want to say thank you for that. And thank you, Helen, for preparing the talking points for the budget work sessions. And if anyone else has suggestions, comments, please feel free to share and contribute. We can only do better by working together. All right. Any questions from me? If not, we're going to go to the committee and working group updates. Housing and supportive services. Audrey.
William, before you move on, did you want to vote on those 2 written statements for the budget work sessions?
Sure. Does anyone have any questions on the written statements? It looks like Kathy raised her physical hand.
Just
Go ahead, Kathy.
maybe just a slight wording, getting back to, I think, Helen, your point that in the budget, it sounds like the county budget has included the 105. Is that right? And maybe changing that to like strongly encourage the board to, keep that in the budget or something like that. Because it looks like in the current, for the March 11th budget workshop, it does mention the 105 gap. So maybe just emphasizing the importance of addressing that gap by keeping what's in the draft budget in the final budget, something like that. Nothing major, but just, emphasizing that that's really critical to maintaining the program and meeting the needs of county residents for meals.
Okay.
Okay, Audrey.
Maimuna or Helen, do you know if additional transitional housing units for people who've been evicted is in the budget or has been talked about? Something we've talked about in the Housing Committee, sorry.
No, it's not in the budget. We have been working with our DHS leadership and our economic independence related to those units. And so we have been successful in acquiring, Jim, is it 8 or is it 6? Get how many units we have.
I think it is 8.
8. Okay, so we have been successful, and maybe what we can do is have that be a presentation to supportive housing in the future, if you'd like that, to know kind of where they are. They're scattered. They're well utilized right now. We do work very closely with Path Forward, so I'd like to acknowledge Kasha in these efforts as well. And we'll continue. So that has been successful to go that route versus in the county budget.
Okay, yes, Tanae is going to give us a presentation at our next meeting about this. And we talked about whether we could be supportive, but it sounds like you have that under control.
Yes, yeah. I'm glad that's lined up. Yep, great.
Thank you. Do we have any other questions? So why don't we just do the vote together? Do we have a motion to vote on the 2 talking points? Yes, we have motion from Roland, second by Carlos. All in favor? Thank you. Any opposition? So the motion passes. Thank you all so much. Ellen, any other suggestions? Okay. All right. So Audrey, please, housing and supportive services.
Okay, I'm going to avoid we did this and we did that because it's all in the board information. But I will say that I have been to the Housing Commission, the Planning Commission, and the County Board to provide public feedback on Melwood and Crystal House. Not some had both, some had only had one. The county board meeting ran till 8 o'clock on Saturday and I had to get off at 6. So I don't know what the final vote was, but I hear, and I don't know if Alice is on, but I hear that it passed. Crystal House 6 was about funding, using AHIF funding, and Melwood was GLUP and zoning. So we are moving forward, it looks like, on both of those. I wanted to say that the Housing Commission has just started an affordable housing ordinance working group. And I am going to be the representative from the Commission on Aging for that. But if anybody has any input or wants to help on the legislative aspects, they want to see if we can do what Falls Church and Alexandria has wanted to do. But I'll be the representative on that. And that's the key things that I have to say.
All right. Does anyone have questions for Audrey? And Audrey, just for everyone else, you feel free to provide an update to the group and to the public on whatever you feel is important. So thank you, Audrey. All right. Next, legislative.
Morning, everyone. This is Anthony. We didn't meet this month. We're meeting next month. Two updates in terms of some of the items, the legislative items and the budget items. The affordable set aside passed both the Senate, and on the 17th it passed the House. So that's in progress. The item on reducing evictions, that has passed the House, passed the Senate, and now it's awaiting signature. And then the other update I have, and the third and final one so far, is that SNAP, neither budget item amendment, survived at this point. So that's unfortunate. So we meet next month, and by next meeting, we'll probably have a more detailed summary on where everything is at kind of its final stage. Thank you.
Thank you, Anthony. Does anyone have questions for Anthony? It looks like Carlos, you had your hand up. Carlos, did you have a question?
Just a question in relation to SNAP not passing. Any sense of what the resistance was? What were the arguments against it?
I don't know right now. That was something I was looking at this morning. When I meet with my team next month, and then the next commission meeting, I should have some more details. Though there is something noted regarding kind of SNAP fraud, but in terms of the kind of budget amendment, that did not survive. So I don't have specifics on that yet, but I'll have something for you next month, since I think that's worth noting.
Yeah, sounds like the usual messaging from the.
Yeah, it looks like Michael Schuster, our chair from Alexandria, added that the budget passed has money for villages. So thank you, Michael.
It also
Kathy.
included money for raft as well.
Okay.
What I saw. So, yeah.
Great.
Yeah, we
All
may
right.
have lost in one area on SNAP, but we kind of gained in other areas, Carlos.
Great, thank you. So it looks like Kathy has her hand up.
I'm sorry, I may have missed this, but what actually was the SNAP amendment? Like what was proposed that did not get passed? Can you explain what that was? Was it an increase in funding, or what was it from the state?
Yeah, it was an increase. Give me 1 second. I'll tell you the specific amount.
Okay.
Everything wants to close on me.
Erica, did you have a clarification?
That was a benefit increase from 23 to 50 for older adults.
Oh.
Yeah, it was going to be a pretty big jump.
Yeah. Okay, thank you.
Yeah, no problem, Kathy.
Erica, did you have a hand up? No? Okay. All right. Thank you. Okay.
Thank you, everyone.
Thank you, Anthony, for the updates. Long-term care, Charlie.
Sure. And actually, I apologize. As I'm sitting here, I realize. Can you all hear me?
Yes, we can hear you. The visual is slightly off, but we can see you.
Oh, okay. I'm having trouble with my camera and audio, but as long as you can hear me, that's the important part.
Yes. Yeah, you're good.
as I'm saying, I realized that my report never got to anybody because I see it still sitting in my outbox as not being sent. So let me verbally give it to you. Our committee met on March 13th, and we were delighted to welcome a new committee member, Megan Holy, a 50-year resident of Arlington, who is now retired, but with 27 years of experience in oncology nursing and other great backgrounds. So a great addition to our committee. Our meeting on March 13th had a presentation by Erica Wood about the Virginia legislative session, including activities of Virginia Advocacy Day, which some of you participated in Richmond. And she updated us on a number of bills that I won't go into here. And then we had our regular updates from Adult Day, the Long-Term Care Ombudsman Program, Aging and Disability Services, and next month's meeting is going to be held at Cherrydale Nursing Home. Sort of not part of our committee, but related to it is the Cherrydale Community Advisory Board, which is now off the ground. We met March 19th at Cherrydale and had a great presentation by Christy King, an emergency management specialist at DHS, who provided a slide presentation on building your own emergency kit. And we dealt with a number of other business items for that meeting. So that's my report.
Thank you, Charlie. Do we have any questions for Charlie? Okay. Yes, great meeting of the Cherrydale Advisory Council, Community Advisory Council. Thank you. All right. Catalina, transportation.
Yeah, so first I'll just try to highlight a few things. I know this was mentioned in Helen's pre-meeting reminder, but WMATA's Riders Advisory Council is seeking feedback for their FY 2025 WMATA Riders Advisory Council report. So I know, Will, you'd flagged this, and I think Claire, you also emailed me to flag this. This one is due by, I think, 11:59 p.m. tonight, and the council is just interested in getting feedback on, Metro Rail, Metro Bus, Metro Access riders from across DC, Maryland, and Virginia. And I haven't been able to fill it out yet. I'm doing that later today, but I've heard it should only take a minute or so. So encourage folks to fill that out. And then last Wednesday, we had our advisory group for Arlington's Transportation Future meeting. So we discussed the draft vision and goals that the project team put together based on all the different feedback that they collected over the phase 1 of community engagement and research that they did. So I think that started like last September or October and continued for a while at all those different pop-ups and open houses and online forums. So I'll make sure that I send those presentation materials and summaries to Helen so she can include that in the follow-up email as well. But essentially the draft vision and draft goals will be the focus for the next phase of engagement. So phase 2 kicked off this past Saturday at the Feel the Heritage Festival. And so the team is focused on socializing the draft vision and the draft goals, which I'll read to you in just a second, and getting feedback on that. And then the next meeting as an advisory group is April 7th. And so before the April 7th meeting, I'm going to try to get all of your input again on the draft vision and the draft goals and invite you to join our next transportation committee meeting so we can discuss that further and then circle back on that. But the draft vision, I'm just going to read this quickly so we can all hear it. Again, these are drafts, and they want me to keep emphasizing that because these came from the feedback that we got, but the whole point is to refine these. And there's a lot of reasoning and rationale behind why certain words were chosen and all that. So the draft vision as it stands now for Arlington's transportation future is this. Arlington's transportation network enables people of all backgrounds and abilities to move safely, comfortably, and seamlessly. Everyone can depend on a variety of transportation options to get them where they need to go, when they need to be there, and when they need to be there. Arlington focuses on making travel a good experience for people, connecting them with nature, friends, family, and jobs. And then the draft goals, again, these are just 1 to 2 word, phrases that kind of orient us in the direction we want to go. The draft goals right now are safe, equitable and inclusive, sustainable, connected, livable, and then transparent and accountable. So I'll make sure again that you get the decks that explain sort of all the feedback that was gathered so far, and then I'll send out a form or something like that so you can give some initial input, but then definitely invite you all to join me at the next Transportation Committee meeting, which is the Friday before our Community Engagement Forum. So it's March 14th at 9 a.m. I think we're in person this time. But at that Transportation Committee meeting, we'll go through a list of questions they asked me to get your feedback on. Do these draft statements reflect your understanding of our priorities and values in Arlington, et cetera, et cetera. We'll also be joined in that meeting by Meredith Bratton, who's a program associate at the National Aging and Disability Transportation Center, NADTC. So she's just going to give a little bit of an overview about NADTC's work and hopefully talk a little bit about their community engagement toolkit. It'll be nice timing before the community engagement forum. Other than that, still working with Helen on figuring out when we can get out to some of the independent living residences to hear from more older adults in Arlington about their experience with transportation. And also the committee put together a list of questions for Kate and the Health and Wellness Committee regarding the Virginia Hospital Center and just some things we want to unpack related to transportation and falls and pedestrian safety and things of that nature. I think those are the main highlights. So that's all for me, but I'll make sure Helen has all that information for the follow-up email.
Thank you, Catalina. A lot of big issues coming up, but thank you for your hard work on it. Joan, I know you go to the Transportation Commission. Anything you would like to add? No? Okay. All right. Yes. So this working group, it's and Maimuna, you had a question.
Yes, thank you. Thank you, Catalina. It might be helpful next month if you all have the time or someone from your committee would want to join the Carlin Senior Residence Community Advisory Council. They already have a scheduled meeting. You can work with Audrey on that. And since you're trying to make your rounds to the senior residences, you would have a captive audience. So
thank you.
Thank you, Amuna. Yes. So yes, this working group, there's a lot of things happening in transportation because as we know, funding is down and need for transportation is up. So this working group that Catalina is on is planning for, I think, the next 25 years, 50 years. So it's a good time to get involved. And also, of course, thank you for the WMATA survey. WMATA, again, also, they are looking at improving things and increasing efficiency. So, and again, I just want to remind, if you want to join the Riders Advisory Council, they're looking for people to join. Right now, I think the average age of members on the Riders Advisory Council is about maybe 30, and so it's a pretty young group. So if you want to provide input on older adults, you're welcome to join. Okay, aging equity, Carlos.
Hello, everybody. It's good to see everybody and online. So you already heard that we're making efforts to support the Community Engagement Forum. This includes having secured a satellite space. That took some negotiations and a lot of back and forth, but it all worked out at the end. The only thing they said was, Carlos, you're in charge. So I'm the one to have the keys. So don't break anything, I'm in charge. And we're getting the flyer out, but I'm having some issues. I don't know why, exporting that to a JPEG file. So if I can get it sent to me as a JPEG file, I'll get it out on our social media platforms and encourage our members to get it out on their personal platforms as well. So we had the chance to defend the grant submission that was done for the Arlington County Equity Grant. It went really quite well. Aspire and Art Against Ageism did an excellent job. And so we showed no next month whether or not we were successful for that. There were two other possible opportunities that we were partnering with to support. One, we backed off because the competition was just fierce. And we just thought it's better to really focus in on something that's much more attainable. But there's a new one that's kind of interesting. So Signature Theater put out a really interesting survey about accessibility and the arts, but it was specific to theater. And as I took the survey, I thought to myself, well, wait a minute, the arts are more than theater. I said we should be thinking about accessibility on many levels, especially around older adults, people with listening or cognitive challenges, even financial. Not everyone can enjoy the arts because there are financial barriers. So I approached a couple of organizations, including Signature and the Columbia Pipe Partnership. I said, what can you guys do under this new grant that was released from the Cultural Affairs Office that talks about accessibility for everyone? So I'm actually having meetings tomorrow with some of the potential partners along the Columbia Pipe corridor, because one of their big aims is to try to partner with spaces that are empty as well as neighborhood associations. So I'll provide more update, but this all happened last week, and I think people are excited about this idea. Then we were approached about trying to rethink how to do Elder Law Day and fold it into a community resource and health fair. So I think it's a great idea. I saw the response, people were much more inclined to support that. And then we're supposed to meet with Charlie in relation to the long-term care quality index quite soon. I'm looking forward to that meeting. And then finally, we are being spotlighted in the Walter Reed Army Institute of Research newsletter. So once it comes out, I'll share that with everybody. Thanks.
Thank you, Carlos. Anyone have questions for Carlos?
This is Claire again. I don't have a question for Carlos, but I wanted to quickly circle back to what's Catalina's comments on transportation. May I?
Yes, go ahead.
Okay, Catalina, I think I'm on the phone, so I don't always get everything straight, but I think you mentioned looking into probably getting feedback from seniors in senior residences, but also in assisted living facilities. And my suggestion to you, and we can work that offline, is the best time probably to do a presentation or try to get some input from the residents. I'm thinking more assisted living residences like the Sunrises or Mary Marshall would probably be at when they have a resident council meeting. And that probably where you would get probably the most audience, but we can help try to set up presentations at various residents council meetings, because I think that's where you probably would get the most attendance. Anyway, that's my suggestion. Thank you.
Super. Yes, and I'll be glad to participate as well. Any comments on that, Catalina? I don't know if you have any comments.
No, thank you. Thanks, Claire. Yeah, we can definitely kind of sync offline, and we'll definitely would love to have you.
Thank you both. Roland. Looks like you're muted.
Can you hear me now? Oh, good. I just wanted to add to Carlos' presentation that we've been working with Michelle Thomas. We have scheduled another seminar on fraud. It is entitled Fraud Alert: Ways to Reduce and Prevent Imposter Scams. That's been scheduled for March 31st from 10:30 to 12 p.m. at Walter Reed Community Center. We're going to have on the panel, Michelle Thomas is going to be on the panel, as well as Sean Smith from the Virginia Senior Medicare Patrol. And we're going to also have Heather Harris, who is with the FBI. And they're going to discuss ways that people can protect themselves against artificial intelligence, imposter frauds, and romance scams. So hopefully we'll have a good turnout for that. That's all.
No, I'm muted. Do we have any questions for Roland? All right. Thank you so much, Roland. I just saw I think it was on Good Morning America today, there was a major scam involving older adults. So it was one of these where older men were lured across into another country across the southern border. And, you know, not only, apparently there were some deaths. So yes, thank you for that seminar. Kate, you've been waiting patiently. So health and
There-
wellness.
Thank you so much. I'll get started and I'll let Kasha hop into, but our next meeting is March 14th, so just a couple weeks away. And we're going to be having some follow-up discussion at our last meeting, which was, gosh, feels like forever ago, but a few months ago. We, one of our takeaways from that was that we really wanted to reach out to communities, residents and communities that could give us better perspective, better insight on, you know, health needs, health and wellness needs. So a couple communities were identified. Those are ones that are identified as medically underserved communities by the federal government. So that using that as a starting place, Kasha has been instrumental. She has a connection relationship with the senior pastor at Macedonia Baptist Church. So she was able to reach out to him to see if he could work with some of his members at his church to come to our meeting and provide some insight, just have an informal conversation around what they're seeing, what they're feeling, what the needs are. So Kasha, thank you so much. We heard from him over the weekend. We've got 4 residents, I believe it is, Kasha, coming to that meeting in March 14th, along with, I think, Reverend Craig may be joining as well, which is great. So we're looking forward to that. Again, just to help us kind of think through our plans and our activities as we move forward. Anyone's welcome to join that meeting. Kasha, did you have anything to add to that?
No, thanks, Kate. I actually have a question for Helen, because one of the questions that came up from the email was the members are not very familiar with Microsoft Teams. So what's the possibility of doing this on Zoom, which is that they're more comfortable?
I believe that Teams is the county approved platform, and so that's what the commission and committee work sessions need to be on. Sorry.
Perhaps if we knew what the members' concerns or problems with Teams is, maybe there could be a brief tutorial or something. Is that possible, Helen?
Sure. Sure.
Okay, we'll reach out back to Pastor Craig and see what we can do to ease the concerns for use of Microsoft Teams.
Yeah, thank you. So Kate and Kasha, anything else you would like to add?
Not from
Okay. Well, thank you for the outreach, which I know everyone's doing or should be doing. So yes, we definitely want to get input from our community members, and also thank you to Health and Wellness for working with Catalina and Transportation on the VHC access. All righty. Does anyone else have any questions for committee and work group that they just thought about now? Okay. Looks like okay, that was Kasha. I saw something on the text. All right, liaison updates. I saw Michael Schuster from Alexandria up earlier, or any other liaisons who would like to give an update? Okay. Seeing none, we'll move on to old business, new business, and announcements. Are there any old business items that we need to chat about? All right, new business. Any new business? Not seeing any. Helen, do we have any announcements, or anyone else have any announcements? Joan, have your hand.
I would just like to mention that in the current issue of Arlington Magazine, there is a good article about the Clarendon Presbyterian Church project on their effort to provide, well, they want to do a project for affordable housing for LGBTQ seniors. And that is of interest, of course, to all of us and working with aging. So I just wanted to mention that. It's a good article about what has to be, well, neighborhood comments and I don't know. It's in the current Arlington magazine.
Thank you, Joan. All right, any other announcements? Great, well, thank you all for joining and for staying alert, united, organized. A lot of things happening, as we said earlier. So please keep an eye out for your friends, neighbors, family. A lot of things are changing rapidly from day to day. Our next meeting is March 17. And of course, we have more meetings of committees in between that are online. So please join in on those as well. So great seeing you all and keep up the good work. Thank you. Have a nice
William, will we actually have an official meeting as part of the community engagement forum like we did last year after?
Yeah, yes,
Okay.
immediately following
so-
the community engagement forum, there will be a short, I promise to keep it very short, Commission on Aging meeting, but please, commissioners, plan to stay just for a couple minutes afterwards. There is some business that we do need to take care of.
Okay.
And you'll give the remote sites time to get there.
Yes, and or have a team so for you all to join in, okay?
Okay, because, yes.
Great. Take care, everyone. Good seeing you.
Bye.
Thanks, everyone. Bye.
Bye-bye.